The recent and tragic death of high school football player Evan Rains has refueled the conversation about sports and heat. Rains died on Saturday at Cape Fear Valley Medical Center after a morning workout with his team. Our health expert, Dr. Campbell, here with more. Doctor, good to see you again.
Good to see you, sir.
It's my understanding that he passed because of heat stroke, correct?
That is the postulation now. You know, certainly we want to confirm that when the autopsy results are released, but heat stroke is a condition in which the body no longer is able to cool itself.
Right.
And so the body temperature may rise as much as 105, 106, 107 degrees, which results in brain damage and organ death.
Yeah. At this point of the summer, consider the dog days of summer, it can get very hot, very humid. We're talking about that this morning, the humidity. Who are the most vulnerable for heat stroke?
Like you might expect, folks who are very young, like infants and toddlers, under the age of 4 are very vulnerable because they can't monitor their own behavior. And certainly the elderly who may not have adequate cooling in their homes. And then folks with chronic illnesses like diabetes or heart failure or other chronic medical problems are much more vulnerable to heat stroke.
Right. With most conditions, I'm sure there are warning signs. What are those for heat stroke?
So heat stroke can start with heat exhaustion, which is when you feel dizzy or lightheaded, all of a sudden maybe a little short of breath. That's something that you need to take that player or that individual over, get them in the shade, give them cool things to drink. Heat stroke is much more serious. It's a medical emergency. You may see unconsciousness, seizures, chest pain, abdominal pain, shortness of breath. Medical emergency at that point.
That brings me to one more question, because we're seeing this video right now of these kids playing. Your recommendation for kids that maybe don't feel good on the field, don't push yourself, right? It's okay to say, I need a break.
Right, and I think coaches and trainers now are tuned into that. When you and I played sports, you know, it was a sign of weakness if you said, hey, coach, I need a break. It is a dangerous situation. Coaches in this area are trained to understand these warning signs. Those players need to be taken out. They need to be put under a cool tree, given something to drink, and maybe even a cold towel put on their head, something of that sort, to help them cool down.
Right. For the everyday citizen, though, what can we do to prevent it?
So I think you have to avoid strenuous activity when it's hot and humid outside. That's not a great day to go walk 18 holes of golf or roof a house. I think you need to be cognizant of the symptoms. You need to understand if you feel short of breath, if you feel lightheaded or dizzy, it's time to get cooled off rather than wait till heat stroke starts.
All right, so if you are feeling some of these symptoms, what can you do? Can you go to the hospital? Can you call 911? I mean, what do you recommend?
So if you have a family member who you think is having heat stroke, call 911. While you're waiting for the emergency personnel to arrive, you can use cool towels, you can use cool water, wet their clothes with cold water, that sort of thing. When we get them to the hospital, we're going to infuse bags of cold saline, we're going to use cooling blankets, we're going to put ice packs under their armpits to help them cool down. Dr.
Campbell, always good to see you, sir.
Good to see you. Thanks for having me.
Thank you. And, of course, if you would like to get in contact with Dr. Campbell, really easy. Just log on to our website, WNCN.com.